Good afternoon. Thank you for all joining us today. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Today, the Orange County Healthcare Agency reported 96 new cases of COVID-19 and 1 new death. This brings our total to 3,092 confirmed cases of COVID-19 and 66 deaths to date. As of today, we have 186 hospitalizations and 69 in ICU. We are very fortunate to have amazing healthcare workers and top-notch medical facilities to be treating this virus. Because of this, our number have continued to remain comparatively low relative to other regions. Additionally, countywide, 1,324 tests were conducted today, bringing our total number of those tested to 43,351. Our healthcare agency, as well as private labs, are rapidly increasing the number of tests here in Orange County so that we can get a more accurate representation of the rate of spread of the virus. The doubling time as of today is 18.4 days, an increase of 1 day from May 6th, while the daily positive test rate as of today is 7.4%. This is in comparison to LA rates of 14% and respectively. Our daily positives are lowering at a significant rate in comparison to where they stood in mid-April. I understand many Orange County residents are concerned about the beach closure at this time. Governor Newsom's permission of Orange County's plans to reopen their beaches was issued this morning. While I'm pleased we are now on the path to getting our beaches reopened, I want to reiterate that the governor's actions on this front were clearly arbitrary and capricious and completely unnecessary. Frankly, I'm still confused as to the governor's motives of singling out our county, which, as I just noted, is experiencing low number of COVID-19 related to other regions. And as we've noted time and again, the reason for that is because we acted quickly here in Orange County, declaring an emergency on February 26 when we didn't even have reported cases of the virus. Orange County from day one has been very proactive in ensuring the safety and public health of our residents. The proof can be seen our comparatively low COVID-19 case counts, deaths, and hospitalizations. All Orange County residents love our beaches, and we want to enjoy to them while getting some fresh air and exercise. The local beaches are ideal place for locals to get a much-needed mental health break. Next, I'd like to address the reopening of Orange County businesses because this is critical elements for our families. Right before this press conference, Governor Newsom outlined the steps that he would like the state's business community to comply with in order to move our state's economy forward. Many Orange County residents are currently dealing with the economic and emotional issues related to the pandemic, and I want to assure you that your county is working hard to assist you. California reported over 4 million statewide unemployment claims in March. In April, numbers come that once released will be even worse, and we in Orange County lost 13,200 jobs in March only. It is because of this drastic increase in unemployment that we must begin the process of safely allowing businesses to reopen. Young, healthy people who are low risk should be allowed to go back to work in order to put food on their tables and pay their bills. Our current course is simply unsustainable. I love to credit to the governor for finally doing the right thing with yesterday's executive order that gives county treasurer tax collectors the authority to waive property tax penalties and interest associated with late property tax payments for economic hardship. As you know, I asked Governor and more than a month ago in order to help our families. There's another way he and those in Sacramento can help. That is by suspending AB 5. AB 5 is hurting our independent workers and gig economy. It doesn't make sense during this difficult time to continue hurting our workers this way. Unfortunately, it appears those in Sacramento, rather than helping our independent workers, are instead doubling down by suing Uber and Lyft. This does not make any sense. I implore them to stop this lawsuit and suspend AB 5. Our communities need all the help they can get right now, not more government regulation. Several weeks ago, Supervisor Wagner and I launched the Orange County Business Recovery Ad Hoc Committee to help assist businesses and during the recovery phase of county's response. We knew that finding ways to restart our economy and assist businesses as soon as it is safe to do so was paramount to ensuring a stronger Orange County. This committee has looked at a variety of angles on how each respective industry would be able to reopen in a safe and efficient way. We have relied on advice of our medical professionals in our meetings to see how we can best reopen businesses and to do so in a way that is medically safe. It's vital that we get all of Orange County back to work safely. We continue to receive correspondence and hear from constituents who are hurting. Today's press conference will Dylan Wright, our Director of OCC, are providing an update on our beaches. Dr. Nicole Quick, our County Health Officer, is available for questions related to the county's COVID-19 response, and CEO Frank Kim is here to answer questions for most matters involving our county departments. And I want to bring Dylan right here. And thank you very much.
Good afternoon. Dylan Wright, Director of OC Community Resources. With respect to county beaches, we received communication this morning that the state has reviewed the county's phased beach reopening plan and has approved that plan, finding it to be consistent with the governor's March 19th executive order. Therefore, we are pleased to announce that beaches operated by the County of Orange will reopen under this beach management plan effective today, May 7th, for active recreational use. The plan for county beaches aligns with local beaches and is posted on the OC Parks website, www.ocparks.com. Thank you for visiting your local beaches and for maintaining appropriate physical distancing and active recreation.
Good afternoon. I'm Frank Kim, the County Executive Officer. I want to thank the Chairwoman as well as Dylan Wright for their presentations. And at this time, we'd like to see what questions we have from members of the media. Moderator?
And again, ladies and gentlemen, if you do have a question, please press 1 then 0 at this time. We have a question from the line of Nick Gerda. Please go ahead.
Hi, everyone. Thanks again for taking questions. I have two questions. One is I understand the county has two sets of data on hospitalizations for COVID. One is from voluntary reports that do not come from all hospitals in the county, and one is from mandatory reports that do come from all hospitals in the county. And I understand the data posted on the county website from those voluntary reports. So my first question is why the county is posting the voluntary data rather than the mandatory data from all hospitals. And secondly, on serology testing, I understand cities like Irvine are looking at contracting for antibody testing in their communities in sort of a drive-through format. The FDA has been cautioning about potential faulty test results with some serology tests. And I was wondering if Dr. Quick could speak to what the cities are considering and what her medical view is of the tests that are being considered.
Good afternoon, Dr. Nicole Quick, County Health Officer. I'd be happy to sort of give an overview again of molecular testing versus serology testing. So as people have heard me say before, the diagnosis of active COVID infection is done via molecular or PCR testing. That's a sample that's taken from the nasal cavity of an individual, and that's run on a machine to detect actual virus particles. So that would be the test that we would use for detection of active COVID disease. There are serology tests out there that measure your body's response to an exposure to COVID, so your antibodies that you form after an infection. There are FDA authorized serology tests. There's commercial labs that offer that testing. What we don't know at this point is whether or not an individual who shows antibodies to COVID-19, whether or not they'll in the future have immunity to a subsequent infection. So it's just too new for us to be able to say yes or no on that. As far as which cities are offering that testing, I can't speak to which cities out there have offered individual serology. What I would recommend is any individual that's interested in serology testing, contact your medical provider and have a discussion about getting one of those tests. I want to reiterate that if somebody does have does get a serology test done and do show antibodies, we don't want that individual to think that they don't need to take precautions against future infections. We still want them to practice physical distancing, staying home when you're sick, washing hands, covering coughs and sneezes. All of those public health measures that we're recommending for everybody still apply even if you show antibodies to COVID-19. And then your initial comment was about the report that we have in our MOAC report versus state reported hospital data. That there are different reports that are gathered, and I think the important component about all of the hospital data is that is a point in time snapshot. That data changes daily and hourly and by the minute. We do post that on our website, so I would encourage people to go there, but it is likely that there would be small differences between what the state is reporting and what we report just based on the nature of that data. Thank you.
We have a question from the line of Paul Anderson, please, with City News Service. Please go ahead.
Yeah, hi. I understand from there are several businesses reopening. They're citing the business guidelines. I have also heard that there's several restaurant owners even met to discuss reopening all their restaurants, and I wanted to find out what how the county is approaching this in terms of trying to get compliance with the state health orders. I spoke with one restaurant that was planning to reopen, and then said the health department told them to not do that. I don't know if that was the county or the states. Can you provide some sort of clarity on how you're approaching these businesses that are reopening that are still in the non-essential category?
Sure. So first of all, we encourage restaurants to be open to the extent that they can provide takeout service that is currently permitted by the state order. The governor has issued an executive order that prohibits the opening of dining rooms. And again, during today's press conference, he reinforced that message as well. So from a county perspective, our environmental health inspectors, the restaurant inspectors that most people know them as, they're licensed by the state, California Department of Public Health. So these inspectors do follow state criteria. So from a strict enforcement perspective, we do believe that it's very clear that restaurant dining rooms are not to be open.
But you've got some. I understand that some leaders in the county are saying that the there shouldn't be any enforcement, and some are saying there should be enforcement. Do you think there's a mixed message going on out there, and that people are confused about where the county's coming from in terms of whether these non-essentials should open or not?
You know, I think the board's had a fairly robust discussion on that as early as this Tuesday. So I know that each individual board member, they're certainly have their own position and their position in terms of what they feel about the governor's orders, et cetera. But the business guidance document that was adopted, the first bullet point in that document identifies that more restrictive state orders are to be followed. So that is the criteria that we are using.
And we have a question from the line of Spencer Custodio with Voice of OC. Please go ahead.
Hi, thanks for taking our questions. I think this might be more for Dr. Quick, but it also might be for CEO Frank Kim. It's in regards to the governor's guidelines that he just released a couple hours ago on how far counties can go and regions can go beginning tomorrow if they were to submit a plan. But anyways, my question relates specifically to, is Orange County ready to go what he calls the later half of phase 2, right? So it could allow for in-person dining at restaurants, but there has to be some benchmarks made, like a minimum of 1.5 tests conducted daily for, every 1,000 people. Also, no more than one virus case per 10,000 people for 2 weeks, and also no virus deaths for a 2-week period. So I'm just wondering, is there any estimate of time, maybe, is it months out, weeks out, on when Orange County might be able to kind of go a little further in this phase 2 that's going to be rolling out tomorrow?
Sure. So thank you for that question. And also, as those guidance just barely came out, we have not put together a sort of inclusive response to that. I can say at this point that some of the key criteria for the prevalence of COVID in Orange County, we simply don't meet at this time. The criteria for no deaths in the last 14 days, we clearly do not meet. So as far as our ability at this time to move more rapidly through phase 2 than the state is, that wouldn't be something we would be in a position to do today. Now, I want to make this clear. We will be looking at those benchmarks and working towards those every day. And so that is sort of a rolling goal. Some of the other things that were mentioned, the testing capacity and so forth, we will look at those numbers. Once again, those just came out. Look at those numbers and ensure that we are adequately there. But some of the criteria for prevalence, such as cases and deaths, we do not meet at this time.
And we have a question from the line of Margaret Guerrero with KNX. Please go ahead.
Yes, Dr. Quick, message for you as well. You were just talking a little bit about, ramping up the testing. Any plans at this point for Orange County to offer testing to all residents, symptomatic or not? Where do we stand on the number of tests and the number of sites that are available for people to go to?
Thank you. We are currently in Orange County working to expand our testing capacity over the entire county. There on our website, if you go to our testing page on there, you can see the community clinics and testing site that are available. I also encourage individuals to contact their medical provider to find out if testing is offered there. We right now are using the prioritization that's come out from the California Department of Public Health for the different tiers of testing and adhering to that at our facilities as well as at our public health lab. To that end, our public health lab is prioritizing testing of SNF, so skilled nursing facility resident and staff, to ensure that we can respond to the outbreaks that we are seeing there. But we are absolutely working with community partners and through the county to increase testing and to meet those benchmarks that the state just outlined as far as where our capacity needs to be moving forward.
And we have a question from the line of Alicia Robinson with Orange County Register. Please go ahead.
Thank you. I have two questions. They're both sort of building on things that have been asked by others. First of all, one of the things that was mentioned in the governor's press conference as far as communities being ready to move farther into stage 2 is the number of contact tracers they have. So can you tell me how many contact tracers the county has available now? Are there plans to hire more? And if so, when is that going to happen, and how many will be hired? And then the other question is kind of building on what Paul Anderson asked about businesses. And I just wanted to know, kind of simply, is the county going to be enforcing the state's existing closure order for services like the restaurant dine-in service and any other businesses that are not cleared to reopen currently by the state?
Sure. So I'll answer the first part of the question about contact tracers. We have expanded our contact tracing that our communicable disease division is undertaking by bringing in other public health employees at this point and reinforcing previous training they had and putting them to work on contact tracing. We will be expanding our contact tracing as needed to meet that state benchmark, as well as to respond to the increase in cases that we will likely see as we let loosen some of these stay-at-home orders. So we will be continually working to ensure that we have the correct number of contact tracers. Thanks.
Hi, Alicia. On your second part of your question, I think the answer is that number one, our environmental health inspectors, again, are licensed by the state, so we are required to follow state orders. So absolutely, that we will go out, and as we receive complaints from individuals in the community, we will go out and investigate. We'll have conversations. Again, the purpose of environmental health is not enforcement. The real goal of it is to go out and meet with the business owners, understand what is happening, identify where they may be out of compliance with the state and or our local business guidance documents, provide them information, have discussions, and really the goal is to seek voluntary compliance and education. And ultimately, that is what our goal is. And our goal is not to run around Orange County and to shut down businesses left and right. That is not what we do. Our goal is to inform, educate, and seek voluntary compliance. Next question.
And we have a question from Tony Cabrera with ABC7. Please go ahead.
So the governor has said that he's open to argument. He knows there are unique conditions and circumstances in each county, each region on that whole regional variance thing, saying he'll try to be flexible. Is there something that the county can bring to the table and say, yeah, hey, we are different. We do have a unique condition. We should move forward a little bit faster than other counties are allowed to?
Yeah, I mean, I would say that just in looking at our data, when you look at the number of positives per the number of tests that we do, we're averaging around 7.4% positive cases. And that is quite low. When we look at it with other larger jurisdictions, such as our neighbor in the north, they are over 12. And I know San Diego is around 6.5. So us in Orange County and in San Diego, we are trending below that 10% positive rate, which before had been used as one of the guidelines from the state, that they thought that we should be testing until you get to a point where approximately 10% of your tests result in a positive case. And we're trending well below that at 7.4. So we're really pleased by the fact that we have been able to bend the curve and get to a point where our testing has ramped up significantly over the last several weeks, and the number of positive cases is well below that 10 benchmark that we had used previously. So, and then when we look at what is happening within our hospitalization numbers and where our deaths are occurring, if you look at our website, we are now reporting the numbers that are related directly to the skilled nursing facilities and the numbers related to our jails. And as a whole, if you look at the number of positive cases and you look at our jails and our skilled nursing facilities, I believe they comprise approximately 16% of our overall positive numbers. And they comprise about 20% of our deaths. I believe it was 14 deaths from our skilled nursing facilities compared to 65 total deaths. So I think that comes out to about 21.5%. You have to check my math on that. But the reason why we're showing that data is, I think if you were to look at our data, and I've asked my staff to continue to refine and put additional information on our website. Our goal really is to show you that if you were to identify what does our community hospitalization rate look like once you pull out the skilled nursing facilities and our jail facilities and homeless shelters, those kind of high density congregate living environments, what does it look like overall? And I think that we'll be able to demonstrate that we're able to have a really a flat curve, and hopefully that it will be declining over time and in the near future. So our goal is to show that within our community that the viral transmission rate and hospitalizations and deaths within our community warrant us to be able to open, particularly looking at the lower risk businesses that the governor's identified in stage 2. We absolutely would like to expedite our movement into stage 2 sooner, and we absolutely will be making that argument to the state. I know that the governor cares very deeply about what is happening across the state of California, but when we look at our data in Orange County, we believe that we can safely move into that phase 2, and we'll be making our best arguments.
And the next question comes from the line of Colby Bermel with Politico. Please go ahead.
Yes, hi there. Thank you so much for being available. Different kind of question, if I may. I wanted to ask about the CARES Act, and apologies if this type of question has been answered already, but I was wanting to know how the county is planning to spend its CARES Act money, and then 2, if the county is running into any frustrations with how that money is allowed or not allowed to being spent, any kind of limitations at all that you're trying to work around or deal.
Thank you. So as many of you know, the county did receive the CARES Act funding on April 22nd. We received $554 million. We are building currently our public health response plan, and we are also working within that framework and funding support for our homeless response. This includes the hoteling that we've all heard about. It includes all the contact tracing on questions that were asked earlier. It will include serology testing, the research components, and at some point there'll be a therapeutic response. And we'll use that funding to address in an expedited manner the ability of residents in Orange County to get access to a therapeutic response that becomes available. So there are quite a bit of funding programs that will rely on that CARES Act. And in addition, we've seen the demand for safety net services rise significantly. We know that the applications for food assistance have more than doubled, and then applications for CalWorks and for other general relief type of programming has increased over 20%. So within our social safety net, we're seeing assistance for food, and for those that have been displaced from employment, access to medical assistance, as well as for short-term temporary resources in terms of general relief dollars and other things. Those programs are all increasing. So we believe that CARES Act will be able to bridge some of those gaps and those holes. And again, I think we do have some frustration that as a county and in the middle of a crisis, we are deeply grateful for the support of the federal government in funding, but we also would like as much flexibility as possible. And waiting for guidance to come from the federal government and then having subsequent questions, it does take time for us to resolve those things. And there is quite a bit of documentation that is required to manage and maintain account for those funds. And while we're grateful, we still continue to pursue opportunities for flexibility, which we think that we need. Every jurisdiction is a little bit different in terms of what their needs are, and we hope that we would have as much flexibility as possible in those dollars. But I can absolutely say that we are grateful, and we need it. We will use those dollars, and it will lead to a robust public health response.
And the next question comes from the line of Coco McAvoy with Fox 11. Please go ahead.
Hi, yes. My question is about the restaurant industry in Orange County.
How has the pandemic impacted the restaurant industry there? And will there be a number of restaurants that will go out of business because of this pandemic?
I think absolutely it has devastated the restaurant industry. And I know that all of us are very frustrated, and I think that you've heard comments from our Board of Supervisors as well as our civic leaders about the impact that it's had within these industries. So 100%. Shutting down restaurant dining rooms has been tremendously negative impact on the capacity for these restaurants to operate. We applaud those restaurants that have been able to pivot and establish and create an effective takeout model. We know that we've partnered with many of them in terms of identifying ways that they can operate more safely. We want to encourage that. We want them to operate. We want them to thrive, and we would love for the state to give us additional flexibility so that we can restore restaurants and their full operating model as quickly as we can and as safely as we can. So it's been devastating. We feel their impacts, and we want to help them. And again, that's why I go back to the earlier question of restaurant inspectors. It is not our intent to go out and be very aggressive with these restaurants. That is not what we do. Our goal is to educate, to make them as safe as possible, to work with them, and to help them remain operational during this very challenging time. And we hope that the state will work with us and allow us to partner with our restaurant industry and get them open as soon as possible.
The next question comes from the line of Noberto Santana from Voice of OC. Please go ahead.
Yeah, thanks again for taking the questions. I appreciate all your work. I guess just kind of two full questions, Frank, to jump on what you just said a minute ago. I guess I don't understand how that will work, and I'm certainly not arguing for anybody to be sanctioned, but for example, the Nomad's restaurant, I guess what I'm wondering is if there's other restaurateurs that are looking at that and saying, well, if those people opened and they were able to function, and as you're saying right now, restaurant inspectors will not go out and in a sense enforce certain things. I guess what I'm wondering is what's the message to other restaurants? Can they open? And if there's nobody to come out and enforce anything, does that just mean that whoever kind of is willing to kind of go on their own there is okay? And then my second question is, with the $550 million that's coming in, and I know it's restricted to COVID stuff, but have you guys started to think about, with such high unemployment, whether the County of Orange will start to institute some kind of, to harken back to the 1930s, some kind of WPA, Public Works program? Do you or board members, maybe Michelle Steele can speak to this, see yourselves instituting any kind of quick program that can begin to, work on trails, other things that are public works projects in the meantime while things are shut down and people need work? Thanks again.
Sure. So to the first part of your question, please don't misunderstand. Our restaurant inspectors are licensed by the state. We're required to follow state guidance whether we agree that it's the best policy or not. So the current order of the governor is that restaurant dining rooms may not be open. But again, enforcement doesn't mean that on a first violation you go out and you pull their restaurant permit and you prevent them from operating. That is not the purpose of enforcement. Again, the purpose of enforcement is to go out, understand what is happening, to educate, to provide guidance, to identify and show them what the governor's orders are. Do they understand them? This is what it means. Here are our local business guidance documents. Here's what they mean. I think that is the purpose, is to go out, educate, ensure that they understand what is happening both at the state level and at our local level, and to engage in that discussion. I think that if we went out and the first action is a written citation where we pull permits, I don't think that we would be very effective. And I think we've had a very well-received and well-functioning restaurant inspection program in Orange County. So we do that because the way that we lean and the way that we work with businesses is not a heavy hand. That is not what we want to do, and we don't want to be known for that. So again, as you can imagine, it's a very difficult time for us. Some of us don't agree that we should be taking an enforcement role, and I absolutely understand where those voices are coming from. Many of us share those exact same views. On your second question, if you could repeat that. I'm sorry, Norberto. I think maybe you might have gotten cut off.
Basically, like harkening back to the 1930s.
Oh, in terms of the CARES Act. So I think that we do have a business reopening subcommittee chaired by Chairwoman Steele and Supervisor Wagner, and any considerations for use of CARES Act for those types of purposes, they would be worked through that subcommittee. I think we have time for at least 2 more questions. Moderator?
We have a question from the line of Chip Yost with KTLA Channel 5. Please go ahead.
Hi there. Yeah, Norberto asked a lot of the question I wanted to ask as well, but I still don't think it's clear to restaurant owners if you could really maybe kind of nail that down, especially maybe Chairwoman Steele, because what the statement that the Chairwoman and Chairman or Supervisor Wagner put out earlier this week does seem in direct contradiction with some of what we're hearing today. I could read some of that statement that the Chairwoman put out. It says HCA threatened the owner with permit suspension. We're talking about Nomad's Cantina, in complete contradiction to the Board of Supervisors guidelines passed unanimously last week. We have worked with HCA leadership about this unfortunate unilateral department action. We understand that HCA will be promptly rescinding all threats and will take no enforcement action against Nomads as long as it continues to comply with Orange County's guidelines. That sounds like it's a thumbs up or a green light for the restaurant to open again. Am I wrong in reading it that way? Maybe Chairwoman Steele could respond as well as Mr. Kim.
So Chairwoman Steele had to step away to another appointment, but what I can share is, number one, I don't think it's appropriate for me to comment on statements by individual board members. I think that would be more appropriate to work through their individual offices. What I can share with you is that the County Board of Supervisors and their business guidance document, at least in the first bullet point, clearly identifies that more restrictive state orders are to be followed. From a county administration perspective, we do read that very clearly to indicate that restaurant dining rooms are not to be open per order of the governor. So that is our understanding, and that is what we're working with today.
And we have a question from the line of Nick Gerda. Please go ahead.
Yeah, I had a follow-up question about the fiscal situation facing the county. We've been hearing today about the state looking at a major budget deficit going into the new fiscal year, estimated at over $50 billion. Wondering what you're looking at, Frank, in terms of revenue hits to the county next fiscal year, what's being pursued to address that, and what your ask is of the state and feds related to that revenue drop projections, and whether you're joining with the governor's call by many governors for $500 billion nationwide for state and local governments. Your general thoughts on kind of where that revenue will come from, what's being pursued.
Thank you, Nick. That's a really big question. I think when you look at the magnitude of impacts, I don't think anyone can accurately tell you over the next 12 months what the exact dollar impact will be. We don't know how quickly businesses will come back. We don't even know today when the governor is going to accelerate and allow counties to move into the full stage 2. We know that there's criteria today, but the governor also said that that criteria could change. So if we're being held to a criteria where you can't accelerate through phase 2, if you have a death within 14 days, I have no idea how large counties like Los Angeles, Orange County, or San Diego ever get out of that in the coming months. So what I'm hoping is that the governor understands the impacts on our local communities, understands the robust response that the large counties have done in terms of their public health departments, and is able to engage counties and have a discussion about modification of those criteria in the coming days. That is our hope. In terms of the fiscal impact, absolutely, it's devastating. Our safety net services in Orange County are funded by a program called realignment. And I'm going to get a little bit into the weeds, but that's the nature of your question. Realignment revenues are funded by sales tax. So as we all know, sales tax is currently forecast to decline 15 to 20%. So if you have a reduction in your realignment revenue of 15 to 20%, and realignment revenue funds your social safety net programs, then you can imagine that at a time when the demand for your social safety net is increasing and your funding for social safety net is decreasing, you end up with a giant hole. And that's where we're at. And that's what we're looking at. The reason why you've not seen Orange County react aggressively to balance its budget is because we're working with the state today. The governor's May revised budget will be released sometime around May 10th. It will take several days after that to complete that analysis. And that is when we will know more clearly what the governor's estimate is of his level of funding for the various programs that counties run on behalf of the state. So depending upon what those numbers look like, that is when we have enough information to react and take appropriate steps to balance our budget in accordance with the funding that is provided to us by the state. The county general fund is a very small component of our overall budget. Our budget is over $6 billion. The general fund is approximately $1 billion. So while we are struggling within our general fund, which is funded primarily from property taxes, we can't use a small $1 billion general fund to backfill the other $5 billion in programs that depend on fees for service, economic activity, sales tax, and other things. So it is a real struggle for us. It's a challenge, and I think that is part of the reason why you've heard a lot of discussion about the CARES Act from both cities and from the counties, is everyone is looking at that funding source as an opportunity to backfill lost revenue so that government can maintain its current level of services. That is not possible. The very first page of the CARES Act document indicates that you cannot use that for revenue backfill. And that is what a lot of the arguments, disagreements, and the background conversations is about how do you get flexibility in that so that you, as an elected body, whether you're a city or you're a county board of supervisors, you can have a debate with the public and engage in how do you prioritize these very important services. In Orange County, we don't do things that are unnecessary. We operate a jail. We operate the district attorney's office. We operate the public defender, the probation department, a social services agency, healthcare agency. All of these programs are important and they create the infrastructure for our society. And all of that is funded either from sales tax, property tax, or other types of funding in that way that is being decimated by the loss of economic activity. And that is a time when our residents expect government to be the rock, to be the stability, to provide consistent law enforcement, to provide social safety net services when people need it most. That is the struggle. That is the reason why we build reserves. I will make a recommendation to the board to utilize some of our reserves. But again, those reserves don't last forever. And Orange County has lower reserves than other counties of our size. And that relates directly to the fact that we receive unequal funding from the state. We are the lowest property tax receiving county out of all 58 counties in the state of California. And so when we are in a period where the economy is expanding, our capacity to build reserves is diminished. And when we're in a situation where the economy is receding, our capacity to draw on those available reserves and manage and provide stability of services, those issues are, and our ability to do that is diminished as well. So it is a challenge for us on all fronts. Nick, that's a great question. I don't have a great answer. We're going to wait until May. We're going to find out what the impacts are from the first rollout of the state budget. We will react and respond very quickly to it. And we will use our limited reserves to prioritize those highest level of services that our community deserves. One good news is that because of the CARES Act funding, I can assure you that nothing that happens in the state budget or with local sales tax or property tax will impair our ability to have a robust COVID-19 response. That absolutely will go forward, and whatever resource they need, they have access to. Thank you for your question. Thank you today.